Let's talk a little bit about the trajectory, the future trajectory of the White House coronavirus task force. The news is that Donald Trump is now thinking of canceling the White House coronavirus task force, even as deaths again spiked yesterday to 2,350 in a single day. And this is like much of what Trump has done in the last 2 months when it comes to coronavirus, which is just a bad, boneheaded idea. But if your concern is just propaganda and pretending that you're doing a good job instead of dealing with the virus, this is exactly what we would expect Donald Trump to do. The task force, I'll remind you, was formed at the end of January. This is the task force where Mike Pence is, I guess, the official head of the task force. Dr. Deborah Birx is the response coordinator. You've got the Surgeon General on the task force. You have that Secretary of Health and Human Services, Alex Azar, on it. He's the one who initially put a former dog breeder of Labradoodles in charge of the day-to-day. Dr. Fauci's on the task force. The commissioner of the FDA, Stephen Hahn, is on it. Ben Carson is on. There's a whole bunch of people on this task force. Now, as it is, the task force has not been super concerned with health and has been too concerned with politics. Towards the end of the press briefings, we would see Dr. Birx become more a vector of disinformation than of science, and that was a horrible thing. But at least you had a task force that was briefing us daily. Well, the press briefings went horribly wrong after the bleach injection fiasco. We've seen those be pared down, really stopped at this point. We no longer see Dr. Fauci or Dr. Birx daily other than in corporate media interviews. And instead, Donald Trump has replaced the coronavirus press briefings with these economic, I guess I'd call them economic agitprop events with business CEOs and other brown-nosing sycophants. But the cases aren't going down. So if you are prioritizing paying attention to the data rather than whether Trump praises CEOs, we are still finding about 25,000 new coronavirus cases basically every single day, sometimes more, sometimes a little less. And deaths again have spiked. Yesterday, 2,350 deaths in one day in the United States, a really bad number. And when you look at what's going on in Italy, when you look at what's going on in Spain, when you look at the curves, and then you see what's going on here, it's not good. And meanwhile, as I told you yesterday, CDC and FEMA have a report which says they fear that deaths might actually climb to 3,000 a day by June 1st, with maybe 200,000 new cases a day. Now, I hope that doesn't happen. As you all know, politics don't play a role in what I hope happens. I don't hope we have one single death for the purpose of making Trump look bad or helping to defeat Trump. The case for that is very clear. There have been enough deaths. I don't want anyone to die. Hopefully it won't happen. But the numbers in a lot of states aren't looking good. Here's Donald Trump asked yesterday in Arizona about the coronavirus task force. Trump stopped at a Honeywell mask required factory. He refused to wear a mask. I'll talk about that later. But Donald Trump, again, talking about we've just done great about everything. And at one point, Trump walked around all day yesterday with a piece of paper in his pocket that was just a graph of the total number of coronavirus tests, which is meaningless, right? We've talked about per capita. Here is Donald Trump's answer, and it includes pulling out that piece of paper when asked about why would you now disband the coronavirus task force?
Everything. And
don't you want to hear from the experts?
I just want to say that we've done an incredible job on testing. With that being said, we have some additional, including antibody tests coming out that will even blow these numbers away. But nobody's done the job we've done. Go ahead.
But don't you need to continue to meet with the task force to get this scientific expertise on this pandemic?
We will have certain people, as an example, we have hospitals that we built. We have medical centers that we built. We have people on the task force that focus on that. We have people on the task force that's focused exclusively on ventilators. Well, we have more ventilators now than anybody in the world, and we're helping France. As you know, we're helping France, Italy, Spain, Nigeria. We're giving, I think, 250 to Nigeria. We have many countries that we're helping. But the ventilator problem is solved, so you don't need that. We have now it's sort of a combination of safety and reopening. So we'll have something in a different form. But the task force, for what we've done, I think everybody out there, when they're being very honest, I think the job we've done on testing will shortly be, and maybe even supersede, Doug, the job that we've done on ventilators, which people can't even believe. We had a call the other day with the governors.
So it goes on for about an additional minute, but as you can tell, there's no answer. There's no answer. The question was, should you really end the coronavirus task force when we are in the middle of a pandemic? And Trump says governors are happy. We have tons of ventilators. And I have a piece of paper with a graph about testing. It's striking me as counterintuitive to end the task force now. And I want to point out one other thing. We've been watching the numbers coming out of some of these early opening southern states, the states that didn't have, these are states that weren't initially hotspots, and they insisted that they're good to go and reopen. The numbers aren't good. Look at just one example out of Texas. In Texas, cases have increased dramatically over the last 9 days. Texas had 535 new cases on April 27. That went up to 960 new cases on April 30. And that was up to more than 1,200 new cases yesterday. Now, understand, the raw numbers are not the important thing here. The percentage increases are. If you see new cases continue to increase in Texas at this rate, their 34,000 cases will be more than 50,000 cases just 10 days from now. And by then, if the other northeastern and west coast states keep seeing declines, Texas will have dramatically more active cases than any of these early hotspots. We can do a similar analysis in other states. I hope none of this happens. But the last thing you need right now is to end the task force and just focus on reopening, since it's that reopening which may indeed wreak havoc in a whole bunch of states. Hope it doesn't happen. It's what the data is pointing to. Check this out. The first 500 people who see this video and go to davidpakman.com/skill will get a premium membership to Skillshare for 2 months completely free. Skillshare is the online learning community with thousands of classes on almost anything you can imagine, always taught by experts. They have classes on drawing, painting, photography, video editing, web design, running a small business, and much more. I recently took a very interesting class called Simple Productivity, How to Accomplish More with Less, and got a bunch of great personal productivity tips out of it. We should allow ourselves a little time every week to either get creative, keep your brain sharp, learn something new. It's great for mental health, and almost all the classes are under an hour, so it's very easy for someone who's busy to take advantage of it. With Skillshare, you can discover a new passion, explore something you didn't know you would enjoy, but there's also plenty of classes for people with experience, so you can just get better at something you're already good at. And again, the first 500 people who see this video and go to davidpakman.com/skill will get a completely free premium membership for 2 whole months, giving you access to every class Skillshare offers. Check it out. I put the link right underneath this video.